joining. What I'm presenting today is kind of essentially this. So it's a kind of a bit of a what is social prescribing, and what's changing in 2025. So I don't know whether some of you are aware. Obviously, the care cap's been sort of threatened for several years. It was delayed, but I think it's now sort of slated for October 2025, which will have a bit more of an impetus in terms of what social prescribing means and will hopefully become a bit more prevalent. We've built a solution already, and we did that in collaboration with a large county council several years ago. So what I'm going to be showing you is the output of that work. And interesting, Gillian, you said, also from a staff point of view. So the mechanism for what we've created essentially allows you to build an assessment, and that assessment can be anything. When we first did it, it was obviously against national frameworks. But the tool that we've got within the solution allows you to build an assessment, which means anyone can access this and assess based upon any criteria. What we've also then got is a mechanism to sort of track that over time. So if you're sort of collecting information, you can sort of track an individual's process, and that's something I'll be showing, which is why I need my browser. And then the product that we created several years ago sort of evolved into a much more bigger tool that's being used within the NHS for a similar type of function, and I'll talk about that, which is why I've got where it says the wider challenge, and then really we've had this product, and I won't say it's been sitting on a shelf because it's evolved into the product that we've developed for the NHS, but we've not seen the impetus from local authorities that we were perhaps expecting several years ago, and largely I think it's maybe because sort of the care cap hasn't come in, so therefore there's not a huge sort of demand for it. But we have seen pockets of interest, but I think the difficulty is exactly what is social prescribing. So hopefully I'll be able to explain and describe what we've built and how it aligns with that principle. So I guess what I've got here is a statement, but I think it's becoming clear that the state of a person's health is linked to many factors, and obviously these encompass the physical realm, things like exercise and diet, but also extend to the social, economic, and environmental elements of our lives. So, the understanding of health is driving a shift towards more holistic models of care that aim to address each of these. And one innovative approach is social prescribing, which a method that tailors care to individual specific needs, and hopefully grants them more autonomy over their own health journey. But as I mentioned, the care cap is coming in October 2025. I've got an asterisk there because it was slated for a year or so ago. Perhaps the pandemic sort of changed the focus on that. But when it comes into effect, I think it's anticipated to lead to a few key changes that I think will make social prescribing more prevalent, really. And the first one really is the financial relief. So with a care cap on costs, individuals are going to have more financial freedom to engage in community and social activities, and this can lead to an increased demand for non-clinical forms of support, which social prescribing absolutely addresses. You've then also got more of an increase on preventative care. So again, the care cap will perhaps lead to a greater emphasis on preventative measures in healthcare, and social prescribing addresses that by the broader elements of health, such as social and community engagement, which can play a significant role in preventing more health issues, therefore reducing the long-term care costs. There's also a shift towards holistic health management, and the new policy is likely to encourage a more holistic approach to health management, considering that an individual's overall well-being is just more than clinical needs. So social prescribing aligns with this by offering a range of activities and support that cater to mental, emotional, and social health. It's also going to, reduce pressure on healthcare services, and with an aging population, with obviously an increasing healthcare demands, the care cap could lead to a more strategic shift to a more cost-effective intervention. And social prescribing can alleviate the burden on primary care and acute services by providing alternative support pathways. And one of the things I'll talk about at the end is where we feel there's a definite circle to sort of that we see within our products, and how local authorities sort of integrating more with the NHS. Obviously, we have the integration of all the integrated care systems which are coming into effect, which actually do join up those two sides of things. So, a greater integration of services. So, the implementation of the care cap might necessitate better integration between health, social, and community services, and social prescribing really promotes this integration. So when we developed this, it was in collaboration with a large council. You perhaps will get a steer from that as I go through the solution. But we went through a fairly rigorous journey with them around defining the service in terms of the blueprint for what was going to be offered. We also involved customers involved in that, but also the third sector, volunteers, and obviously health and social care professionals also contributed their expertise. So the solution is very much aligned with those objectives. So you might have seen a process like this, and obviously we've got a completed version of this, which obviously we're happy to share as an output at the end of this session. But essentially, what we developed was a tool for professionals, so i.e. social workers or healthcare professionals within local authorities, to actually do the assessment whilst they were sitting with a citizen or patient. What we've developed or enhanced further since we developed this solution is actually becoming more of a self-sufficient service that citizens can undertake themselves. So we have a portal product as part of our offering, which obviously lots and lots of councils are using to kind of signpost to the typical services around waste, around sort of council tax and things. So we've built the self-service assessment aspect of it into our product. So as a local authority, you could take that product and happily sort of do these assessments with staff, or you could sort of empower citizens to do it. And I think when the care caps comes in, there's going to be more emphasis on people sort of self-serving. So what I'll be showing currently is the staff sort of aspect of completing it on behalf of a citizen, and there's a number of elements involved. There's the assessment. There's matching the output of that assessment to services or service providers. There's then a directory of services where service providers can manage their own content. And then finally, I was showing you the tool that is essentially used to build the assessments. But those assessments could be for anything, really. So that's what I'm going to show you. And this is just going to be a number of static screens. And at the end of that, I'm going to show you our portal product where a citizen could do this on their own. The big caveat on that, though, that's our demo system. It's not particularly branded. It's not designed thoroughly, but it hopefully show you the functionality. And then I'll be linking in around our sort of a wider healthcare solution later on. So I will be showing you how a citizen can do it, but for this initial one, we actually from a staff point of view. So this is the scenario for this example is a member of staff going into the solution that we've built and wanting to sort of view an individual's assessment. So the first thing that we'll see is a number of assessments that have been completed by Mr. John Smith. Obviously, this is a fictitious person. He's on working with a professional or member of staff, has actually completed a number of assessments. So what I'll do is kind of clicking one of these. So the wellbeing assessment is the first one I'll look at, which drills down into the questions and answers. But essentially, what we've got here is a number of things. So these can actually be ticked, against these facets. So emotional health. So obviously, what we've got here is somebody on the member of the citizen's behalf gone in and clicked on this is a big concern for me, or a slight concern, and essentially then what happens is this is captured. The output of this is essentially this diagram here, and this can be done over time. So the more times this person does it, we will build a history of this person's kind of state essentially. But what we can do is based upon the answers to those questions, we can either link them to a further assessment. So obviously, if someone is borderline being referred to social prescribing, we could actually ask some more detailed or specific questions. But then what we've got here is essentially the ability to filter based upon what this individual's kind of responded to working with a member of staff. Once we've then sort of filtered down what those needs are, we can then match those with providers, and this is where the Directory of Services comes in. We use some different terminology as part of this, which I'll explain as we go through. But what we can see here is that this individual is matched with several providers. Obviously, Dorking Care, is one of the demo bits that we'll be going through today. But essentially, what this has done is kind of matched this person's needs with providers who meet that criteria. If we then sort of go back, we can then, the conclusion for this assessment could be do this other assessment. And then obviously what we can do is then go through and complete that. So the output of that first assessment is wanting to do a second assessment to delve into a bit more detail around what that person's kind of needs are really. So what we're seeing here is very much of an admin panel within the solution. This isn't really aimed at citizens completing this, but I will show that as we go through. What we've then got is the directories. So this is essentially where care providers can, or directories can be created, which then allow you to kind of point people to specific directories based upon their needs. So what we've got here is the ability to kind of define those scheme types and the service types, and then essentially, sort of match them to, what you're offering. So what we've got here is education, befriending, advice, and guidance. And obviously these can be defined, or that you can add a service at the point of creating these assessments. And then essentially, you can then match the audience type. So if someone, matches certain criteria, you can then match them using the rules to that scheme type. So this is essentially the background of what we've got here. But then from a directory owner's point of view, I'll just skip through some of these. This is where they can say, are you able to afford to put heating in when you need? Are you able to address? This is where essentially you can define those questions or needs. And then this is what's used to kind of match against care providers. So what we've got here is then the admin panel for the service only. So this will be either individuals providing care services, or in sort of district nurses or private care companies. Obviously, I'm going to be picking on Darwa King Care. I think that might be a real company, but we've obviously just got sample detail in here. So I can add a service. So obviously, I've just got a number in here at the moment. So as you can see, we've got Age UK, Alzheimer's Society, but I'll be picking on Darwa King Care. And then what you can do is then, if you've got a number of sites, i.e. these might be care homes. So this particular company might have several care homes within the area. This is where they can add those. We can then align those with the directories. So this is essentially where you've created that directory, and then you can align this service provider to the directories that they meet, i.e. the services that they're able to provide. And then also the kind of session time. So if these are predefined sessions, you can define that here. What we've then got in, and you'll see that we've actually called it QUAL, which stands for quality of life. So the two products within this are essentially what we call quality of life and directory of services. But those two elements really make up what is the social prescribing solution. So this is a member of staff creating an assessment. And again, this is where you can go through and essentially create any number of assessments. So what we've got here is all the assessments that have been created so far. And these could be matched to individuals based on what you know about them within their account, or the individual can just say, I want help on managing money or staying safe in my own home. And then what we've got here is the description behind the assessment, and then the ability to add the questions. And then obviously each question, can be based upon a number of facets, and this could be against national frameworks or anything that you want to do. So again, Gillian, if you wanted to kind of do like more of a staff survey type thing, to ensure that staff were, healthy and keeping physical and active and things, you can define this. The answers are then essentially scored, and obviously it's that scoring that builds up that picture, which then leads to the outcome or the assessment conclusion, essentially. And then once we've got those configured assessments, we can then sort of create those rules. So if someone that is completing this particular survey, I'll just click through this because it's just display all the needs. This is where you can link individual answers to those questions to a pathway. So if somebody says, this is really important to me, it can either sort of trigger another survey, another assessment, or it can trigger a referral to a directory, for example. And this is where you can assign those rules. So essentially, if someone, if all the answers are, sort of a big concern, then obviously, we want to know about them, we want to intervene, and we can then go into our further assessments. So what I've got here, this is what I was talking about, my live browser. So in the background, I've got my portal account. So this is the IEG4 portal solution that we offer. As you can see, we've got a whole bunch of things here. Obviously, we're not sort of bothered by these today, but you'll notice we've got a wellbeing tab at the top here. So as an individual, I've logged in. This is my personal account with the IEG4 solution. As I said, the big caveat of this is not design. It's very much a kind of a blueprint design, but hopefully you'll see the functionality. So these are the assessments that I can sort of undertake. As I said, these could be a complete long list of things that you can sort of take people through. But in this instance, I'm just going to go through wellbeing. What it's going to tell me is that I've already completed the assessment once, but if I do it again, we can show how our answers have changed over time. So this is essentially, the ability to kind of sort of, go in and drill down and sort of take up these. So if I wanted to, sort of talk about, I won't pick on anger or alcohol or depression. I'll say, let's pick on health, for example. So if I pin that to my account, when I go back to my wellbeing board, what I've now done is pin that to my dashboard. So this is my health. So I could have a number of assessments here, but all I'm interested in doing is actually finding things around health. So this is how I can sort of pin that to my dashboard. But what I'm going to do is just do an assessment now. So I'm going to start the assessment based upon social health. So when I meet people, I feel good about the impression I make on them. So I'm just going to randomly just tick some of these just to kind of speed up this process. But again, this is the assessment that you could do in the background and define. When I press complete, what it's now going to do is kind of give me an output based upon how I've scored when I did the initial assessment to how I'm now scored in the future. So this is how you can track people over time. So this is just a kind of a brief example of the tool, really. I'm going to skip on to the next section, which is really where I kind of want to talk about sort of squaring the circle. So as I mentioned, our product so far was developed with a county council, but then it kind of evolved into another solution for the NHS. So I don't know whether any of you are aware, there's a solution called Digital CHC that the NHS offer. It's a well-kept secret. I think the kind of prevalence of it became more apparent during the times of COVID, because lots of people that were being discharged from primary care were having CHC assessments done to essentially evaluate whether the NHS would, fully fund those citizens being discharged from hospital. I've also got a personal story in this. So my mum, who sadly passed away, she had Alzheimer's, but she had to go into care when she was actually already in care. And at the point of discharge, they were actually, sort of a bit worried about her state. Obviously she got dementia, so that was declining, but her physical state, they said, she was very dehydrated. So they said, we want to make sure that she's getting the best care from the private care home that she was in. But it's the first time we'd ever heard of CHC. And what we were able to do is actually to get fully funding for her during the last months of her life. So it is a kind of a fairly robust process. So what we built is essentially similar. So it's an assessment tool that professional healthcare workers will do on behalf of citizens. And then what it's about is matching those with care providers in the community. Often citizens will not be approved for continuing healthcare because it is purely based upon healthcare needs rather than social care needs. But often the failover for that is something that the local authority will know, typically the social prescribing assessment that I've shown you today. So where we feel our two products, so what we call Qual and DOS, obviously quality of life and directory services, are really a failover to the primary healthcare service, where perhaps the citizen doesn't quite meet fully funding from the NHS. It might be partly funded, but inevitably that citizen might need to kind of be sort of put into a care home, which the council will know about and can support and obviously also recommend. There's a definite question to ask, because there's a predictability about when someone's been in primary care. There's a pathway that if someone's been in primary care a couple of times, often they will drop out of the NHS and become be required to be cared for by the local authority. But often they don't know about those citizens until they drop out of the NHS. However, there's lots of things that the local authority can do to mitigate perhaps the circumstances for citizens perhaps going into primary care in the first place, things like installing trip hazards. So, being able to kind of, enable citizens to kind of track and assess their own kind of needs through our social prescribing tool means that you've got that kind of early intervention aspect, as opposed to, sort of, you don't know about them until they drop out the NHS. So we feel there's a definite question to ask. Now, we do see where there are integrated care systems coming online, where there is that kind of more joined up thinking. But obviously there is one big pot of money in the UK for care, and obviously the care cap is going to bring the emphasis on the fact that that will be capped, and people will have a lot more choice around, where they get to spend their money, either self-funding or where the cap kicks in, and the local authority will have to take over. But I think knowing about these citizens ahead of time before they go into primary care, because then it might be too late. So as we talk about, prevention is better than sort of cure. That's where we feel there's a question to ask. So what we feel is that we're in a unique position where we see both sides of this fence, really, and we can see there's a definite need for the NHS and local authorities to join up. I will share all of these slides, but we do have some videos of all the things that I've shown today, which go into a lot more depth around sort of actually taking the quality of life self-assessment. But also, one of the things that we built into our product is to enable friends and family to do that on behalf of citizens. So typically, I would have been doing this on behalf of my mother, but doing it via the council system. But as I said, there's also different healthcare assessments. So, rather than just health or social care, we've also got mental health assessments. So these are some videos which take you through that process. So in terms of what I had to present today, that is pretty much it, really. I'm going to stop